My name is Melissa Rebronja. I am a trauma-sensitive healing practitioner and host at healyourheart.love. And today's guest is Dr. Arielle Schwartz. Dr. Schwartz is a licensed clinical psychologist, author, wife, and mother in Boulder, Colorado. She offers trainings for therapists, maintains a private practice where she provides psychotherapy, consultation, and supervision. She is the developer of resilience-informed therapy, which applies research on trauma recovery to form a strength-based trauma treatment model that includes EMDR, somatic body-oriented psychology, mindfulness-based therapies, and time-tested relational psychotherapy. She's been teaching therapeutic yoga since 2008 with an emphasis on applied polyvagal theory. She is the author of 7 books, and they're all amazing. This is her latest one, which I highly recommend, Applied Polyvagal Theory in Yoga. She also has a therapeutic yoga for recovery flip chart, a couple of books on complex PTSD, and more. There's another book called Post-Traumatic Growth. They're all amazing. Highly recommend. She believes that the journey of trauma recovery is an awakening of the spiritual heart. Her website is drarielleschwartz.com. Hello, welcome. Thank you for this opportunity. I feel really honored.
Happy to be with you.
How did you end up in Boulder? Is that your home or did you move from somewhere else?
I grew up in New York on Long Island, and I slowly made my way out west. I went to college in Ohio. I had a friend of mine when I was in college tell me about a school in Boulder called Naropa University. And she said, you might really like to check that out because it's a small Buddhist-based school, so forth, but they were at the time one of the few places in the country and in the world, this was in 1994, that was offering programs in somatic psychology, a master's degree in somatic psychology. And so I drove through Boulder in 1994. I fell in love with it and fell in love with the school. And then I continued further west and worked in Utah for 2 years before moving back here.
Interesting. Okay. Beautiful. And how did you decide to be a somatic psychotherapist? Like, how did you find out about even the word somatic?
Yes. My first introduction to somatics was while I was in college, and I had my own struggles at the time. I certainly was dealing with my own complex PTSD, but didn't have the terminology for it or the words for it. I just knew that I had a lot of anxiety, that I was feeling somewhat depersonalized. I was struggling with just my overall sense of self and self-worth. And I had a few places where I had this kind of remarkable homecoming to myself. One was on the yoga mat. That was kind of always the place where I came home to myself and didn't really question it. It just became the go-to where by the time I graduated from my undergraduate studies, I had a daily practice that was my lifeline. My other introduction to somatics was that in that same time period, the same friend that suggested I move out to Boulder someday or go to Naropa invited me to attend a body mind centering workshop. And body mind centering was started by Bonnie Bainbridge Cohen and all of these beautiful pieces. But basically, I went to this workshop not knowing a whole lot about what I was walking into. And it was profound. And we did a lot of crawling on the floor and rolling and rocking your body and having these experiences that opened something up. Now, by saying that it opened something up, it was both uncomfortable and profoundly connecting, right? Like I felt myself and I felt all of the grief and the distress that I held all at once. But I was just so curious when I came out of that of like, what was that? And how do I find out more?
Beautiful. I love that. And you kind of got me back into yoga. I'm so glad that you did. And I was trying to think like, what was my first yoga class ever? And it was Bikram yoga in 2001. I lived in Vancouver, BC at the time. And I look back and I'm thinking it wasn't very trauma informed because it's very much do this, do that. And I remember doing it and it's intense and it's hot. And then maybe 4 or 5 years ago, I was introduced to yin yoga. There used to be a place close by, and she was saying things like, just check in with your body and do what you want. And I'm like, ooh, I like this. And
Mhm.
then I've attended a few of your classes and absolutely love them. It's just so
Mhm.
gentle, beautiful. Everything's an invitation. I mean, that is your book. Like, this is a gift
Mm.
to all yoga teachers, not just yoga teachers, but just healing practitioners in general and therapists. It's just so beautiful and valuable. What has been your journey in terms of, okay, you're doing yoga and then bringing in the trauma informed element?
So I think for a long time, my identity as a yoga teacher and a yoga practitioner sat in one lane, and then my identity as a therapist, even a somatic therapist, sat in another lane.
Hmm.
And that they're both such deep loves. I have been teaching yoga for 30 years. I started teaching yoga in 1994, even before I did my teacher
Wow.
training.
Okay.
Yeah. Because I
And
was living when I moved to Utah, I was living in a very rural community and I had my daily practice. Again, it was a non-negotiable. This is how it was my
mhm.
medicine in that I knew that I would be less anxious for the day. I knew that I would feel more grounded in myself. So it was my daily practice. And no one else was teaching yoga out there. So I was just relying on books that I had, and this was before YouTube.
Right.
Even existed, I think. So, there were no smartphones. I had an old word processor. I don't even think I had a computer yet, right? So all of these ways in which I was just trying to sort out how do I take care of myself. And because this was my practice, people around me said, well, what are you doing? And can we do it with you? So I just started to
Ah,
informally start teaching. And at the time I was working with adolescents, youth at risk and so forth. And then I just got invited in to teach in a residential center for youth at risk. And they were eating it up and they were loving it. And so after I taught for 2 years, I then went and did a yoga teacher training where I became official, right?
right. And what
And
kind of yoga was it?
well, it's kind of an interesting story. I did my teacher training at Kripalu, which I loved, and it's a hatha style, but it's also deeply, deeply spiritual. It is just such an alignment with the entire eight limbs and lots of yoga nidra, and it's not yin per se, and it's also not vinyasa per se. It kind of sits in the middle of a deep connection to yourself, and the Kripalu style lends itself so well to a trauma-informed approach because there
Hmm.
are phases in which, the first phase is very structured, and then we let go of those structures, and it's very much about surrendering and listening to your body and how your body wants to move.
Hmm.
Also, at the time that I was practicing in my 20s, and what I started teaching was also in the forms of Kundalini yoga. And then when I moved to Boulder, there was a lot of Ashtanga. So I've, as a practitioner, really engaged in many different styles and kind of gathered and garnered aspects of many different practices that have really worked for my body. And I've also had to, at times, go through what I think happens a lot in the yoga communities is both at Kripalu, the primary guru there got kicked out because of
Mm,
aggression sexually, financially. And in the Kundalini yoga community, there were also
yes.
problematic aspects. And so, what I've had to do is really separate from those teacher-based practices and the misuse of power and learn a
Yes.
lot from what happened in those
Hmm.
incidents
Hmm.
so that we can actually take what's the core essence of the practices that are deeply beneficial and separate them from these systems that can be really harmful.
Hmm. Beautifully said. I was going to ask you about that. And I think that you modeled that beautifully,
Mm,
just being who you are. It's
thank you.
very attractive in a sense that we need more people like you, just being you and not making it about all about you in a way, but yet teaching so much.
Thank you.
I was going to say we need more women. I mean, yes, we do, but I'm not going to say that all men are going to be the same. It's not true.
That's
Yeah.
right. I think that what you're speaking to, though, is also what we need is this deeply respectful approach to the teaching, whether you're a man or a woman. But there's
Yes.
also even a feminine element to the teachings, which
Mm.
is much more in the element of listening and receptivity rather than doing
Yes.
and action focused.
Yes. Well
Yeah.
said. I originally came across you because I took the integrative somatic trauma therapy. And why I took that is because I wanted to be trauma informed. And I took it with the Embodied lab and it was great. And then I also did the mentorship with you the year later,
Remember?
2003. Yeah.
Mhm.
And that was also awesome. And especially watching you work with clients was so enlightening. And again, it was just you and being real. There's
Mm.
this sense of, yes, I'm a somatic psychotherapist. And sometimes you also wonder if you did your best. You're
Mm.
just meeting people in presence. And that was
Yeah.
so beautiful. So
Mm.
thank you for that.
Yeah, thank you.
What is your definition of being trauma informed? Because now
Mm.
it's becoming more popular to be
Mhm.
trauma informed or to be a trauma informed practitioner. I would
Mm.
just love to hear your definition of how you would define that.
My mind is still sitting with the previous question, which I don't know that I finished. So I'm going to go back for a moment and then I'll
Sure.
loop back forward to
Yeah,
this
let's do that.
question, which was really just kind of holding that my yoga sat in one lane and that my role as a psychotherapist sat in the other lane. And even though my first experiences of bringing yoga into psychotherapy go all the way back to teaching those kids in that residential center,
Mm-hmm.
I then kind of separated the lanes and allowed myself to do my yoga and to do my therapy. And then in about 2007, everything kind of converged. I was doing my doctoral studies and I was doing a dissertation on the integration of mind-body therapies into psychology, into psychotherapy. And I was working in a community mental health setting where I had an invitation once again to create a yoga-based program, a trauma-informed yoga. It'll tie to your second question,
Mm-hmm.
into an intensive outpatient program, an IOP. And so I developed this 6-week model that I kind of piloted in the IOP program at the Community Mental Health Center. And it was fantastic. I learned so much doing it. I got so much out of the feedback that I got from the participants. I had opportunities to then train folks at the center in the model. And then I took it when I left the Community Mental Health Center several years later, I really took it out into our community. And so for many years, I taught this 6-week class model here in the Boulder community that took kind of small batches of students through the trauma-informed yoga. And I'll get back to what we mean by trauma-informed in a moment, but ultimately what this did was it encouraged me to trust that it's okay to bring those lanes together. And so in the last 2, 3 years, especially, I've been really exploring how do psychotherapists bring yoga-based practices into our work as psychotherapists. So the flip book that you mentioned and the applied polyvagal theory in yoga are really aimed in that direction. All right, what is trauma informed?
Yes.
Trauma informed. Thanks for letting me loop back for a minute.
Oh, of course.
Trauma informed is really being aware of how do adverse life events impact our nervous system, our sense of self, our emotional processing, our sensory processing, and our felt experience in our bodies. And it's a way of being aware that how we process the world when we've experienced trauma looks and feels different. And what's delicate about it is that sometimes on the surface, we might look the same.
Mm-hmm.
But what's happening inside below the surface is a tremendous degree of sensitivity to sounds or sights or touch or smells, a tremendous degree of sensitivity to interpersonal exchanges and dynamics that happen, and feelings of rejection or feelings of shame,
Mm.
experiences of anxiety, or experiences of not quite knowing who you are or feeling disconnected from yourself.
Mm-hmm.
And so a trauma-informed approach is really just a deeply compassionate approach to understanding another person and how adversity has impacted you. How does it
Mm.
impact how your sense of self and how you show up in the world?
Mm-hmm.
And I play with that a little bit in my own work because when I first became trauma informed, right, back I
Mm-hmm.
trained in EMDR back in 2001, and it really dramatically changed my practice where I started getting a lot of individuals being referred to me with a large deal of both single incident trauma and mostly complex PTSD,
Right.
accumulation of all of this repeated adversity in childhood. And what I found is that having only a trauma-informed lens is actually pretty limiting.
Hmm. Interesting.
that what it does to us is that it basically kind of puts this magnifying glass on what's wrong and the
Right.
symptoms and the disturbances and the problems.
Yes.
And so I call my work resilience informed therapy,
Which I love.
specifically
Yeah.
just, yeah, thank you,
Mhm,
just to
mhm.
broaden that lens.
Yes.
Right. Now we can also look at what are your strengths? What are your access to resources? What are the things that you're already doing to take care of yourself? Who are the people in your life who are nourishing for you?
Hmm.
And when we shift that lens just from trauma informed into also being resilience informed, I find that my patients feel more hopeful at the end of a
Hmm.
session and throughout our work. And I feel more buoyant at the end of the day.
Beautiful. I love that. You just answered my question about
Mhm.
resilience informed, which I absolutely love. And the interesting thing is that in my own healing journey, after COVID, for me, I was like, okay, I want to go back to school and I want to dive
Mm,
deeper. And I actually took an eco psychology course, which was
beautiful.
lovely. That's where I learned that I'm a settler on stolen land in on Turtle Island because I most of my life was spent in Canada. I've been in
Mhm,
the States for about 13 years. And then I spent 10 years in former Yugoslavia just before the war. For me, Turtle Island is like my safe haven. I left war torn. Now I have to, like, there's trauma on this land as well that we're still dealing with. And of course, the
mhm,
current war, it's just Earth, poor Mother Earth, right? And what humans are doing to it. And then I found the Embodied lab and I did the somatic attachment therapy. I did a few certificates. It was just perfect, lovely.
mhm,
So then when I discovered your books that I absolutely love, and I consider myself complex PTSD, I dove into your books. And the one that I don't have is post-traumatic growth. And I feel like a part of me was not ready for it. I'm like focused on the trauma still, or a part of me was, but I'm definitely getting there. And especially a big deal for me was that I traveled back to my home country
mm,
after 20 years. And it was very integrative for me, also a little bit triggering. And
mhm,
it took me like, I would say 5 months. I returned in October to land back here again. But I
mhm,
finally feel like myself again, and I'm glad I did that. So
mm,
now, after this interview, I am going to get the post traumatic growth book because I feel like I can see that I'm on that journey, but I wasn't ready for it. So I
mhm.
think that for people, if the trauma informed lens is new and they've never addressed that and they never looked at it, that's kind of where they need to be. And then, of course, the resilience is part of that. So it's kind of like a journey, right?
Yeah,
Yeah.
so true, so beautiful. And for me, the writing of the post-traumatic growth guidebook, it's the one that's behind me here, was very much a process of growing myself.
Mm.
And, you know, I've written a lot of books, and I often set out at the beginning of writing a book with the clarity that I don't want to be the same person I am when I finished the book as I was when I started writing it. That each of my books has been its own kind of transformational process, and I've grown along the way. And certainly in the post-traumatic growth guidebook, that was very much the case. Each section in it was kind of something that I was working through in myself to reclaim pieces of myself. And then became kind of, I envision it of like if I'm, you know, blazing a trail through the wilderness, I can leave some breadcrumbs, right? So that
Hmm.
like there's ways in which we can all find our way through what can sometimes feel like the impossible task of recovering from traumas, or as you said, you know, I don't know if I'm ready for that yet, for that growth side of it. I
Hmm.
still feel like I'm in the dark woods. I can't see the clearing. But the book actually follows the arc of the hero or the heroine's journey. And it's very much about kind of knowing how to find your way through the dark woods.
I love that. Yeah.
Mhm.
Yeah. Very cool.
Mhm.
So complex PTSD, is it still true that it's not recognized in the American DSM?
In the ICD-11, which is the International Coding of Diagnoses that's put out by the World Health Organization,
Got it.
they've already added complex PTSD. The US system is still using the ICD-10, which is not yet inclusive of complex PTSD. And we were supposed to transition to the ICD-11 in 2022. and it's delayed with the pandemic, and I do not know when that transition is taking place.
Okay, but it probably will happen. So there's
Yeah.
just a delay. Okay. EMDR and somatic therapy are the two modalities that you work with and that are actually. So I also had an EMDR therapist and it did help. It did prepare me for this trip to go back. It was very helpful.
Mm-hmm.
And somatic therapy, I've had a little bit of somatic therapy as well. And then I just got into my own journey where now I'm becoming a focusing facilitator and teacher. So that's
Beautiful.
really helped me. Thank you. I find that with somatic therapy, it's not what people think.
Mhm.
So I would love to hear for people that are new, why do you find that EMDR works well for healing trauma in your
Okay.
experience?
Yeah, there's a few questions in there.
Yeah, there is.
Um, I think I might start with why somatic therapies aren't what people think. I liked that a lot.
Well, my thing is it's not what people think because it's not fast.
Exactly.
It's like not like it's not like, oh, I want somatic therapy and I'm healed. Like, no. It's like literally not. It's presence. It's
Exactly.
tracking. It's being with, right?
So true.
Yeah.
So true. And so that's why I wanted to start there, especially nowadays when you can see on, your social media feeds,
Yes.
at least I do, a lot of people popping up with this exercise and that
Uh-huh.
exercise and these quick fixes and in 30
Yes.
days heal your nervous
Yeah.
system and blah
Yeah.
blah blah.
Yeah.
Right. And, I mean, I've been at this for 30 years and I'm still gathering parts of myself back. And how beautiful. We have a whole lifetime to
Absolutely.
to find ourselves. And if we try and go too much too quickly, it's like going to the buffet, throwing everything on your plate, and then feeling nauseous afterwards.
Yes,
And
exactly.
literally, you can overwhelm your system. And so you just want to take one small bite-sized piece at a time. And the other thing is that very often somatics isn't about these large gross motor movements, but it's very much about the subtle internal experience of yourself. Just as you said,
Yes.
it's about presence.
Yes.
So, yes to that. And how it relates to EMDR therapy, one of the things that I'll offer around that is that EMDR therapy is rooted in mindfulness. And a lot of the modern somatic therapies are also rooted in mindfulness. And by mindfulness, it doesn't mean sitting on a mountaintop and meditating. It's really about non-judgmentally being able to turn towards yourself with acceptance, with compassion, with curiosity, right? This ability to look towards yourself and say, I wonder what that's about. And can I explore that? And can I really be compassionate around those places where I might feel stuck or where I might feel shut down or where I might feel anxious? And how do I notice that in my body? So when we add the EMDR piece to this, we can focus in on specific life events that may have contributed to those feelings of stuckness or disconnection from yourself or feeling overwhelmed or shut down. And we have a specific protocol or way of working with those events and what it leads you to believe about yourself. How do you feel in your body? What emotions are coming up? What images are stuck around that event? And then we work with bilateral stimulation. Bilateral
Mhm.
stimulation, either through the eye movements themselves or other forms of listening to sounds or holding pulsars or tapping. And that it's this combination that facilitates brain integration and brain and body integration so that the impact of those adverse life events doesn't have as much power over us. We
Mhm.
can reflect upon them, think about them, wrap our consciousness around them, be present with ourselves in relationship to them. And we build what we call coherence or this kind of whole sense of self that I can understand how the events of my life have shaped me, have shaped how I react to others and to the world around me. And because I have that self awareness, I can better be able to track the impact that I have on other people.
Mhm.
And, therefore it supports my relationships.
Beautiful. Do you think that everyone is on a healing journey, whether they know it or not?
It's an interesting question. Do I think that everyone's on a healing journey? I think everyone's on a journey.
Right. Yeah. Yeah.
And I think the healing journey is one that we consciously choose and step into, right? If I go back to the hero or heroine's journey here with the post-traumatic growth guidebook, that concept of the hero's journey comes from Joseph Campbell, right?
Mm-hmm,
And
mm-hmm.
he was a American mythologist and integrates kind of understandings of these arcs of stories that we see in mythology and in movies and in books and so forth.
Yes.
And that there is a point in which adversity in our own personal life, in our family history, in our collective systemic world that we share, that those adversities impact us if we pay attention to it, right? If
Yes.
and especially if we're sensitive to them.
Yeah.
And then we either consciously move into a way of working with that adversity, consciously move towards our own struggles, our own stuckness, or we don't. And
Yeah.
he describes that as this threshold, right?
Mm-hmm,
That
mm-hmm.
we often will resist stepping across that threshold. We
Mm-hmm.
will, in a sense, reject the call into the hero or heroine's journey because either we don't feel like we can handle it or we truly can't handle it yet. We don't have the resources. We don't have our team of allies to help us
Mm-hmm.
go in, into that dark forest or whatever it might be. And so I think that there's a whole lot of us in the world that are in that stage where we're rejecting the call.
Mm. That's well put. I mean, for me, it was interesting when I traveled back to Serbia. I'm of like two mixed, so that's why it was complex for me, which adds to the
Yeah.
trauma. Over there, people just feels like they moved on. A war happened and there's just like no healing. And when I was there, it's like my nervous system was overtaken by them, where I was starting to question, am I the one that's delusional or indulging in healing? Life just, you just move on. It was very interesting to
Yes.
be physically there with the majority of people. You just move on and everybody changes. Not, I wouldn't say everybody, but that was still triggering to see people smoking a lot, but that's how they're dealing with stress. Because I would be sharing like my traumas, and then they
Mhm.
would have even more horrific stories. And then I would ask, like, did you talk to anybody about that? And they were like, who do you mean? Like, it was like even a weird question. So I feel lucky to be living here, to be able to be on that journey.
I mean, what you're speaking to it reminds me a lot of Gabor Mate's work
Mhm,
with this
mhm.
idea of the myth of normal. Like that there's a certain amount of what we might see in culture of accepting as normal a degree of living still as a traumatized people,
Yeah.
right? So the chain smoking and the not talking about it or the whatever other behaviors you might see that can be, in a sense, a reenactment
Mhm.
of traumatized and stressed states, but it's not trauma
Right.
because this is the water I'm swimming in. That's all I
Exactly.
know.
Yeah.
Yeah.
I'm curious about your spiritual journey
Mm.
because I can feel it. There's this sense of peace. Like you seem like you are in peace and you're calm. And there's also part of me, I'm like, could I imagine Ariel getting angry? Like it would surprise me, but I'm sure you have healthy boundaries and you could.
You should
It's
talk to my husband.
right. There you go. Yeah, that's usually the case. But overall, there's a presence, there's a stillness, there's a seeing in you. So I'm just curious, were you raised a certain way, or what would you say about your spirituality and your spiritual journey?
Thank you for asking. Wow, I've got to pause on that one for a moment. It's a beautiful question. So I was raised both in a Jewish family
Mm-hmm.
and also with opportunities to go to these yoga communities from the age of 7. So my parents were divorced when I was 4, and really separated even younger than that, 2.5, 3, and they both got remarried. And my father and stepmother became very involved in their Jewish community. And so at their household, I went to synagogue and got introduced to Judaism in a rather deep way. But I struggled there. I struggled both because that side of my family was challenging for me, and also because when I would go to synagogue, there would be these beautiful prayers that would be sung, and I connected so strongly to the musicality and to the prayerfulness, but I didn't connect to the tradition in a sense of sitting, of reading. It wasn't an embodied spirituality except
Mm.
for the singing. And
Mm.
so I would look forward to going to services primarily for the music. And then I would go home and I would remember sitting in my bed and I was really struggling with a lot of suffering in that household. And I would have these private conversations with God on my bed.
Mhm.
And that was where I felt most connected. And again, this is a bit of an intimate story, but one of the ways that I coped as a child with the struggles that I was experiencing was that I would rock myself to sleep. I would rock in my bed and I would have these conversations with God. And somehow that rocking movement was deeply soothing. And that was where something opened up for me. In my other household,
Mhm.
again, two lanes that I get to
Mm.
keep converging in my life, but in my other household, we went to yoga ashrams, again, age 6 or 7, to Muktananda's ashram. I write about that in the Therapeutic Yoga for Trauma book. And the experience there of going to these spaces where, for example, we attended a Shakti pot with Muktananda, in which, he bopped us all on the head with a peacock feather and everyone's, singing and chanting and there's incense. I remember doing yoga at the age of 7 and being able to embody being a tree and a snake and,
Wow.
um, you know,
Mhm.
a camel, right? Like all of these, a mountain. And I loved it. It
Beautiful.
was so playful.
Mhm.
And so there was this kind of deep spirituality that I experienced there, but I didn't understand yet what a role that would play in my life until becoming an adult and really finding my own spiritual path and how all of this, again, kind of these various threads braid together for me.
Beautiful. Wow, I love that. I didn't know that about you. Would you consider yourself spiritual?
I'm spiritual and not religious. And my spirituality certainly rests into the Judaism and my roots and also my ancestral roots of
Mhm.
sensing how hard my ancestors had to work to maintain their own sense of identity and their own practices. Going back on my mother's side, Jewish people being placed in pogroms back in where my mother's family was from Kiev and then from Budapest,
Mm.
and ultimately being forced to leave their countries. And on my father's side, from Hungary and from Bohemia, those parts of Eastern Europe. And so, again, ultimately, everyone converged here in the US. And my mother's a first generation born in the US, my father's second generation. So you don't have to go that far back in our
Mhm.
family roots to feel where we too were displaced. So my
Mhm.
spirituality rests on all of those felt experiences of what does it mean to be safe in this world and to find a sense of rooting and find a sense that we are deeply, for me, to be spiritual is also to be so deeply connected to the earth, as you were speaking about with Turtle Island, and to feel that grounding of that which is larger than me that holds me.
Mm, beautiful. I love that. You mentioned in your bio that, actually, I'll read it. It was so beautiful. She believes that the journey of trauma recovery is an awakening of the spiritual heart.
Mm,
So I would love to hear a little more what that is and what you mean by that.
yeah. That it's such an intimate journey, right? Whether this is one that you are moving through on your own or with another person, that it's about knowing for you how you live in alignment with your, I don't know if you want to call it soul's purpose, your life's purpose, and a sense of meaning. And so that spiritual heart, I'll use the word soul again for a moment. James Hillman, a Jungian psychotherapist, referred to soul as the seat of meaningful experience.
Hmm.
how do we create a meaningful life? When I was writing the post-traumatic growth guidebook, one of the pieces that I was studying was about a values-driven life. How do we live this
Mm,
meaningful life? And one of the writers that originally wrote about this was Viktor Frankl. Viktor Frankl, who was both a Holocaust survivor who then
mm,
became a psychiatrist and the developer of logotherapy
mhm,
and a form of existential therapy, basically. And that his work looked a lot at how do we live in alignment with our values, right? If we have certain values, for example, values of social justice or values of being in, compassionate relationship to ourselves and others, values of nonviolence, you can fill in the blank of what your values are. But
mhm,
if we have these values and we're not living in alignment with them, then there's this discrepancy. Then we're not living that values driven life. We're not living a meaningful life. So his definition of a meaningful life is to close that gap between
mhm,
what are our values and what are our actions.
mhm,
And that sense of the spiritual heart, I culminate in the post traumatic growth guidebook around this concept of writing your own kind of personal statement, your values driven statement that helps you define what does that look like for you and
mhm,
how do you close that gap? How do you awaken that sense that each and every day I can stand in that sense of integrity that I know I have a good enough sense of who I am, even if I'm still evolving and growing, but I have some sense of comfort in who I am, and that my actions in the world are something that I'm proud of.
Beautiful. So when I was raised in former Yugoslavia, the country was atheist mostly. So I was
Mhm,
literally raised like people making fun of religious people, like you were stupid if you believed that there was a
mhm,
God, adults saying like, how can you believe that there's something there? So when I started my healing journey, I started to sing and write music, and I was writing the truth of how my heart felt. So I didn't know at the time that I was actually starting my healing journey. I always had a voice, but I never knew how I would songwrite. And suddenly I was songwriting after I read the book, The Artist's Way. It opened
mhm.
my
Oh,
creativity.
sure.
Yeah.
Mhm,
And she addresses that like God is just the word and you can, use universe. And that was helpful to me. But then I started believing in something more than just
mhm,
the material because I don't know where this is coming from. I'm writing these songs and it feels somewhat
mhm,
magical. So it opened me up to my spiritual life. And then I dabbled in religion, but it didn't really, I just didn't resonate. Like you said, depending on where you're born, so it's like these are the two options I have because I'm from this country. Well, what if I like
mhm,
something over there, right? So living in North America, we have those options. More recently, I've joined some atheist groups on Facebook because my mom is still an atheist, my dad is spiritual, and I have relatives that are still atheists. So I have inclusivity for all,
mhm,
but it just seems like our world sometimes doesn't. Because I think like that's a personal journey, your spirituality and lack thereof. So I was just curious, how do you bridge that? People that are, there is no God.
mm. Yeah. I also sense that there's something more. I probably would say a little bit in alignment with like a Jungian perspective, that there is a collective unconscious that we tap into that has within it the deep sources of soulful wisdom that we can access that go beyond any one individual. Because how could all of the thoughts and the contributions and the creations and the music of this world not have created a fabric that is so much bigger than any one individual, right? It was so sweet. It just comes to mind. My son is home from college and he was playing piano in our house last night. And he loves just to compose music, make up stuff, pull pieces of things that he thinks he'd heard. And all of a sudden he's playing something and he said, I thought I made it up, but I realized that at some point I'd heard something like this. And he found a piece on YouTube that was very similar to what he was playing.
Mm,
And but I do think that we, in a sense, are tapping into, it's a weird statement, but like kind of like recycled
yeah.
creativity, right?
Hmm.
Like there is this huge amount of beauty in this world, and we can open ourselves up to it, and we can allow that to flow through us. There's also a huge amount of pain and disturbance in this world, and
Yes.
unfortunately, people open themselves up to that, and that's what flows through. Now, whether you call those things good and evil, or whether you call it, light and dark. It doesn't really
Yeah.
matter to me. I think if we go back to a Jungian perspective, that one of the counsels that we receive there is that integration of shadow. That if we can, in a sense, and this is very yogic as well, if we can yoke the light and the dark within us. If I can, going back to your sweet question of like, can Arielle get angry? Heck yeah, right? And I've got lots of, there's lots to be angry about in our world.
Yes. Yeah.
There's lots to be angry at.
Yep.
And anger is in itself, when it's channeled, is a powerful and profound and necessary force that can be
Mm-hmm.
protective.
Mm-hmm.
So we want to not just be light and love and rainbows,
Yeah.
right?
Yeah.
Even though that's lovely,
Yeah.
but we also want to be able to channel ferocity when it's needed. So I would say that for me, I love mythology for this reason, right? And we have mythologies that we can find in every religion as well. They offer their mythologies, and we can study them through the lens of mythology rather than truth. And we
Mm-hmm.
can see these parallels that we can find across different lenses that we look through.
Beautiful. You mentioned recycled creativity, and I feel like that recycled wisdom as well.
Yeah.
My last question is, trauma healing is going to continue to evolve. Will you be writing more books, and will you stay with us on this journey?
Sure. I'm trying to take a break from it, but I've just finished my 8th book. So that one will be out sometime next year. And it's lovely. It moves a little bit out of the yogic territory, the yoga territory, back into applied polyvagal theory for trauma recovery.
Mhm.
And it has a lot of embodied wisdom within it. I've really been enjoying writing this book as well, and of looking through the lens of all of the different ways in which, at this point on our planet, trauma shows up, whether that's individually or collectively, and how we can work with our own nervous systems to be a source of goodness in this world.
Oh, that's beautiful. I love it. And I feel like people need to hear it many, many times, especially with the technical stuff. I heard Dr. Maureen Gallagher say that if you understand polyvagal theory, you're trauma informed. Like, she just made it simple like that, but it takes time to understand. So I love that you bridged that in this book. It's very, very helpful. So thank you for that. And I look
Thank you.
forward to your next book. So you have a retreat coming up.
I do.
Yeah. Do you want to invite people to that?
I sure would love
If there's
to.
room, right? If there's
Yeah.
room.
Yeah. I think as far as I know, there's still room. And so this retreat is in just outside of Boone, North Carolina, at the Art of Living Retreat Center. It is an Ayurvedic center. So you not only do you get to spend time with me doing nervous system based care and learning about polyvagal theory and doing some polyvagal informed yoga and pranayama breath work and meeting really amazing, like-minded people. I mean, it was amazing when we did this last year. So it's coming up this September. It is September 2024, Art of Living. It's the 20th through the 22nd. But it's also at this incredible Ayurvedic center. So you are eating incredibly nourishing food, and you can go and get Ayurvedic treatments that are just kind of leaving you feeling so deeply nourished inside and out.
Beautiful. Wow.
Yeah.
Yeah, it sounds like a real treat.
Yeah.
Yeah.
And other ways that you can stay in touch: subscribe to my newsletter, come to the YouTube channel, subscribe to that, and you can come take live yoga classes with me on Zoom, or you can catch them on YouTube, and all of that can be found at drarielleschwartz.com.
Beautiful. And read your amazing books.
Yeah.
And there's audio as well. Yay.
Yeah. Yeah.
Thank you so much, Arielle. It's been lovely to have you.
Thank you, Melissa.
Mare darshan ki bella, ye